Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Kyna Fong. She's CEO and co-founder at Elation Health. Welcome, Kyna.
Thanks so much, John. I appreciate you having me.
It's amazing to have you on. I mean, I've known you a decade. I saw you in the coffee shop in San Francisco where you and your brother had an idea and a dream. So it's great to have you on. But for those that don't know you and don't have that history, tell us a little bit about yourself and Elation Health.
Yeah, no, it's been quite a journey, and it's been awesome to see your journey as well. But yeah, so a little bit about myself. My name is Kyna, co-founder and CEO at Elation, as you mentioned, and Elation is a SaaS technology platform purpose-built for high-value primary care, and so about 32,000 clinical users use our technology to deliver high-quality healthcare to over 15 million patients. And what we really believe in is the power of primary care to transform healthcare and to really deliver the value proposition of improving people's lives while enabling them to, be healthy in their communities and save costs for the overall system. And so myself, I was trained as a game theorist and a health economist. Prior to starting Elation, I was an economics professor at Stanford. But if we rewind all the way back, the way I started Elation, or the way Elation got started is I worked in my dad's practice since I was a teenager. So he had a primary care practice, solo family doc, and I helped him do everything from set up the practice, negotiate with insurance companies, hire staff, the whole 9 yards. And that was a great introduction to healthcare. And most importantly, I think the quality and the importance of relationships between physicians and patients in healthcare. So a bit about me.
Nice.
Excited to be here.
Well, I love the child labor. My kids work for me on occasion too. My son's done video stuff. I love it. It's a good way to teach your children.
I learned something. Not clear exactly what they might take away, but yeah.
Well, you understood the problems firsthand if you've worked the front desk and done a practice management, seen the doctor, right, suffer through some of the things and challenges they face. So that's awesome. We want to dive in on this interview, really talking about my favorite topic, ambient clinical voice. Some people call it an AI medical scribe. Elation Health announced that you have your own ambient clinical voice AI medical scribe solution. Talk to us about that, the story behind it. Why'd you decide to develop your own versus work with some of the others out there?
Yeah, it's something our notice this product is something we're incredibly excited about, and obviously, it overlaps in the kind of scribe, ambient scribe space as you described. But we also see it as really a gateway and an opportunity to do a lot more for the physician beyond helping them, save time on documentation and write notes. But in addition to that, really trying to be an assistant for the physician to say, hey, what else needs to happen? What are actions that need to happen beyond just the visit? Whether that's orders or referrals or prescriptions, and then all the way through to, hey, an encounter, a physical encounter with a patient is an inflection point in that relationship of setting, the care plan on the right path. So how do we then enable that care plan to be, followed, delivered upon, iterated upon based on feedback, and ultimately impactful for the patient?
Interesting. I've always thought that ambient clinical voice solutions, these scribes, would become a full AI assistant. So it's interesting you're kind of attacking it from the beginning that way, which makes sense. You have the capabilities and access to do that. How would you compare, other than, it sounds like you have a much broader view of this AI assistant than just the medical scribing, creating the clinical notes. How else does it compare to I could list off the dozens. It seems
Yeah.
like there's a new one every day of technologies out there. What are some comparisons, to your solution?
Yeah, I mean, I would say at the heart of it, the differentiators, at least like even in, just thinking about that scribe aspect, are they all sit in the realm of being the EHR and being the workflow and having a broader understanding of the context of the patient and the encounter. And so anything from like deep integration with native templates, right? So obviously we have access to the templates, we understand how the physician's using it. Many physicians use their templates as basically mini agendas that remind them of what they want to do with the patient over the course of the visit. And so, you know, our script is template aware, it fills in the templates accordingly. And you know, there's a lot of opportunity there too. If you think about what's actually happening there, it's a lot of opportunity for the scribe to then be more proactive about how to make that encounter as effective as possible. And so that's one example. There's other things around just clinical context. Like a very basic one would be, you know, having access to the right gender and pronouns for the patient. It's a very irritating thing to have to edit at the end of a visit through a note. But you can even extend that to not only the context about the patient, what existing conditions they have, what are new conditions that are being identified, although that then can facilitate coding, but all the way through to, oh, what are the actions that need to be taken now? Oh, I heard a prescription was described. How do we tee that up? So it's sent to the preferred pharmacy for the patient at the best financial with the best kind of copay and financial coverage, et cetera, and all of that being teed up for the physician. That both enables a higher quality encounter that is more high quality for the patient to be able to do the things that were talked about, and then at the same time save time for the physician, which is such an important value proposition of all of these ambient technologies.
That's interesting. I mean, the fact that it's template aware, I kind of love that description. It probably means it's more granular data. And then because you have the entire clinical context, assuming they've had other visits before, or even the intake or whatever it might be, that's interesting. The gender, that's not a small thing. That's actually a big thing because it's a major annoyance if you have to change it.
Right. Yeah. So it's, and actually that's one of the, I think, huge and understated opportunities, and actually just maps to, how, technologies, especially EHRs, have been so classically frustrating to clinicians, right? It's not, it'd actually be an easier problem to solve if it was just like one thing you point at and like that feature is broken. And if you just fix that feature, everything would be better. My burnout would go away. I'd be happier. But the reality is, I mean, they talk about it, it's like death by 1,000 cuts, right? It's like all these tiny things that are, incredibly frustrating and time consuming, and they add up. And at the end of the day, it leads to those bigger macro issues of burnout and, excessive pajama time. And so, I think the capabilities now of solving problems, both big and small, like as we think about it, we want to leverage AI and LLMs, not just to solve like big problems or launch big features, but also, the small things and get them right. So we can, give joy in 1,000 ways.
That's awesome. Yeah, I mean, I heard someone say yesterday, no one likes enterprise software in any industry. It's the minutia, it's the paperwork. No one likes the paperwork, but we want to get paid, so that's why we do it, right? Like,
Yeah.
or we want to be compliant with regulations or whatever it might be. So, yeah, that's an interesting way to look at it.
But I think that's where there's a, as an optimist, like there is a potential to bridge those needs, right? So again, enterprise software, it's like, okay, it's compliance, it's getting paid, so you have to check the box, and it's okay if it's hard. But, in a world where you can have dramatically different user experience and user interfaces that are much more friendly and more like interacting with people as opposed to interacting with like a really rigid software, my hope is that paradigm gets turned more on its head, and software in general is just more delightful to interact with.
Yeah, well, that's why clinical voice hasn't need $36 billion of stimulus money to be adopted. So yeah, I think you're right. I think it's going to fulfill at least some portion of that dream. I think that's awesome. So walk us through the workflow. What does it look like for a clinician? Talk about some of the onboarding as well. How do you approach that? Are you training them? Are they doing it themselves? What does the workflow look like, including, onboarding?
Yeah. Yeah, well, it's something that our providers can turn on by themselves. We have a, start or try, scribe capability within the product, and you turn it on. So it doesn't need a ton of setup or training or whatnot. And it just starts listening, and it transcribes the visit for you, the exchange that you're having with the patient, And one of the powerful things that we do as well is one of the things we noticed is the way a lot of the scribes operate is that they listen to the entirety of the visit and then sort of drop a whole completed note after like a minute of thinking. And it actually makes it quite a bit harder to vet, like, hey, did something get in there that was not right, or does this overall note make sense, or did it miss something? And so one of the I think differentiating parts of our experience is we actually continually generate the note at a short interval during the encounter, so that it's something you can the physician can glance at, make sure that the right things are being captured, and adapt accordingly. And so that continuous note generation is an important part of the experience. We're also highlighting where the AI is actually, it's different colored when the AI is the one who's generating the text. You can see, hey, this is AI generated, so your eyes go to it more quickly. And that, for example, is differentiated from the template or other things that you're pulling in from the chart. So you can see what the AI has been doing. And then finally, there's an opportunity at the end to review. You can both review the transcript, kind of remember word for word what happened, or just look at the completed note and hopefully it looks good and you can sign it off and go on your merry way. But if there are any issues, like a really important part of this has been learning. And so there's always opportunity to give feedback and identify, hey, here are places where the note could have been improved. And we're really excited at the progress and the effectiveness that we've seen so far, and continue to improve it as well.
Sure. Well, I love the idea that it's being done continuous. Going back to your point, the template is often kind of a roadmap for them, and so then they can say, probably remember, did I do that with this patient or not? And by doing it continuously, they could view that, which is pretty interesting. I like that. It's a smart approach. Now, are you doing it on their phones, on the computers, on tablets? How does it work for your clinicians?
Yeah, I mean, it's any of the interfaces that they're using today to interact with EHR and the note. So any and all. What we tend to see though, because when we most of our physicians, I mentioned primary care, longitudinal relationships with their patients, they tend to have a plethora of information they're trying to see about a patient to really grab their context and understand what needs to happen. So, a good amount of just larger screens and whether laptops or computers or whatnot. But yeah, the modality is, we can support however the physician prefers.
That's awesome. And this question is almost dated now, I think, but how much of this is automated with technology versus are there humans in the background? Is it an all technology solution? It's interesting, that evolution, which has been all towards technology, but I'll let you answer.
Yeah. It's a funny question to ask because I think where things are evolving is even bringing in things that technology wasn't even doing before, and getting AI or LLMs to do that. So I mean, the place where there's human involvement is really on our own learning and quality. Like nothing can beat at this point. We've built capabilities to assess quality in an automated way, like use technology to assess note quality and make sure it's meeting sort of a standard that we set out from the outset. But at the same time, nothing beats having a human at least look at what's happening and say, hey, and we have physicians who are doing that, and so say, hey, is this doing what we want it to do? How could it be better?
Yeah. I mean, increasingly we see this. It's all technology because the cost of a human scribe verifying it and taking it from 98 to 100, I don't know. Well, we'll see how it plays out. Maybe there's a few doctors who want that, right? But
yeah, it dramatically changes the cost is basically what you're saying. I think it's this actually goes back to another aspect that I think has been a big learning for us and really important about just the adoption of these AI and LLM technologies is related to design. Like when you think about it, when we think of LLMs, it's all about the technology, and it's fascinating and incredibly disruptive technology. But one of the things we've learned is to get rubber meets the road. How do you actually get this disruptive and incredibly capable technology into the hands of users who will use it? And actually, a lot of it comes down to design and how you design for trust of what's coming through, because it becomes much more of a, on the one hand, the amazing thing about it is it's a magical experience, right? On the other hand, the part where you have to build trust is, well, it's a magical experience. So how do you know what's coming through something you can strongly depend on? And so, that is I think a really important part that really the whole industry is thinking about and really working on, because that's ultimately what will drive adoption.
Yeah, absolutely. And it'll be interesting to see how we adapt to mistakes and how that impacts different people as they see it, right? But I think a lot, like you said, everyone's putting a lot of thought into that. So you talked a little bit about your integration with the EHR. Obviously, it's a little easier since you created the EHR too. But talk to us more about that integration. And are you looking to offer this kind of solution to other EHR, or are you just like, no, it's so embedded, we can't really do that?
That isn't a priority right now. I would say that like as I've talked about, I think the big differentiating parts of what we're doing have to do with how it is integrated natively into the EHR. And so that's kind of where our heads are focused now. And I think we'll just keep pushing the envelope for that, and maybe think later about whether this can benefit more people, which obviously is a critical part of our mission. But yeah, right now, I think the ways in which we are investing to make it as useful as possible depend on having some pretty extensive access to the EHR, data and workflows.
Yeah, you probably have enough to work on. No, talk to us about the clinician experience. Do you find that they have to change the way that they're talking in the exam room to make this work? I mean, the obvious ones we've seen over our series is you have to say it, what you see and think, so far the AI can't pull in. So you have to say it. Are there other things you see as far as ways that you're training the clinician to make sure that it's that it's an effective solution for them?
Yeah, for sure. I mean, just connecting back to what we were talking about, even some of, there are ways to set up templates to be even more useful for you once you have the, this added capability on top of it where the AI is interacting there. So definitely optimizations there. And certainly the way that physicians speak to the AI, and this is probably something you've heard, but I mean, at the end of the day, it's like speaking to a person, right? So if there was somebody you were talking to, a human scribe, you're gonna say you'll realize that saying things a certain way is going to be more effective. And so inherently humans are learning beings, and so they're going to learn and be able to be identify when they can be more instructive to get the outcome that they want from the scribe. And so I haven't heard that that's necessarily been a negative experience. You could think that ideally it changes no behavior, right? You just stick it in there, it just does what they did every single day. But at the same time, I think it's within reason how, and a natural part of just interacting with something kind of human-like that's doing work for you, that's assisting you.
Yeah, and yeah, I'd say over the series we've heard that almost not quite the opposite, but kind of the opposite is true, that the patients love it because now they're saying, oh, this is what I'm seeing, this in the
Right.
left knee that needs this, and I'm going to prescribe this. So then, the patient gets to hear it, and it creates a better experience for the patient as well, is what we're hearing from a lot of different people. So
Yeah, 100%. And I love connecting that thread to the patient awareness, patient trust, and then patient education, right? Like, because you can connect it to ultimately, in a world of open notes and visit summaries that the patients have access to. It's an inadvertent benefit, right? Where the patient was hearing the key things that were noted, and it's a great opportunity to ask questions too, and just be more understanding of, okay, how or more educated about like how the thought process of your clinician, and therefore hopefully leading to a deeper understanding leads to more engagement, leads to, the right behavior change to, um,
Yeah.
be as healthy as possible.
Better relationship. Yeah, that does that. You talked a little bit about accuracy, but I'd love to dive in more there. How accurate is your solution? How do you measure it? Everyone looks at it a little different. I'd love to hear how you approach kind of accuracy.
Yeah, that's a great question. We have different internal metrics that we look at to try to measure accuracy and quality. And they also there's ones that are sort of literally on accuracy all the way through to, well, what's the overhead to the physician? Because that is the real the real tangible value that accuracy basically translates into.
Yeah.
And so, now we look at things like the percentage of the note that is quote unquote accepted, like untouched, right? But I think the gold standard is a touchless encounter, right? It's like, hey, everything happened, the note looks great. All the actions are teed up for me, and it's not even a thing, right? Wrapping up the visit is saying bye to the patient. It's not going through a whole cycle with my
Clicking the button that
technology.
says approve.
Exactly.
Sign.
So that's definitely the standard, and what we've seen is a pretty good proxy for the effort and the overhead is basically how much of the note has to be edited afterwards. And so, getting that into, as close to 100% as possible, and actually seeing ways that directly map changes we make to increases in that probability, in that percentage, have been really powerful. And some of that actually starts to get at physician-specific preferences, right? Customization, because for better or worse, physicians do document have a lot of personal preference as it relates to documentation, just like humans do, right? Some people like to write in bullets, some people like to write in narratives, some people like more information, some less. And so really getting at preference as part of that objective of minimizing effort to close the note and close the visit is really important.
Yeah, I mean, that's a really good point because you might have two things. The AI may have been accurate, but they just prefer it this way.
Yeah.
And you have to take that into account. That becomes a fail if they have to correct it because they really want it that way. I've heard a lot of people talking, well, doctors need to be okay with some minor changes. And I think that's going to be the battle a little bit with, ambient voice, and it'll be interesting to see how it plays out.
Yeah, yeah, yeah. I mean, also because if you just like take that one step further, it's like, well, because a big part of the note, yes, it's compliance documentation, supporting billing, all of that. But if you rewind in history, there was a time where the notes were how physicians communicated with each other around like what happened with this patient. And then now probably eventually AI is going to be doing all of that summarization of what happened in the encounter. So I don't know. It'll be fascinating. But I agree. Like I do think the net effect will be more standardized notes, like less variance. But I do think today, from the frame that we think a lot about, which is in some sense a more consumer-oriented, user-oriented view, is like we want this to save our users time, and we want clinicians to like do less work. And so, the fact that not all of them will assess accuracy or value accuracy the same way as they might just formatting and style is relevant.
Yeah, that's really interesting. And I agree completely. I think there's a future where the AI is going to create a patient version, and it's going to create a nurse version, and it's going to create a specialty version and a primary care version and a hospitalist. There's going to be so much data that we're going to have to, and the AI is going to create one that's relevant to that specialty or that need. So yeah, I mean, it's just the beginning of that, I think. So it's really interesting. I mean, speaking of specialties, I know you have a big focus on primary care, but I also know a lot of people on Elation that aren't in primary care. So, how does your product work across various specialties?
Yeah, that is true, and I would say our product does work quite well across a variety of specialties. Well, it works extremely well for any the subspecialties that practice that have longitudinal relationships with their patients. Like that's really the core concepts that we built around. And so, we're definitely seeing growth in on that front, because in some sense they're practicing, lowercase primary care. I would also say that, we have the privilege of working with a lot of provider groups who are on the forefront of innovating in primary care, and whether they're in advanced payment models, opportunities for them to be innovating in care delivery. And so when you see primary care in those worlds, they become increasingly multidisciplinary, and they're thinking about not just primary care in the classic sort of internal medicine, family medicine, sense, but they're thinking about, hey, do we have the set of providers to care, really be the home for a patient and be their primary care team? And so, whether it's, mental health, behavioral health providers or others, it's been very fascinating to see those primary care teams evolve, and, Elation evolve alongside that as well. But yes, it's our product does work quite well beyond primary care. We talk about primary care in a big way because we think it has just so much opportunity to make an impact. And it is a lot of how we think about our roadmap and our strategy.
Yep, absolutely. So I always say at the end of these that people are going to want to check it out. They got to get their hands on it, try it out. I'm sure you've already communicated it to your users, but for people that are interested in what you've created, want to learn more about Elation Health and the solution, where can they go to learn more?
Yeah, just go right to our website, elationhealth.com, and you'll be able to learn about the product. And also there's a link right to our Note Assist product right on the front page.
Awesome. Kyna, it's been amazing to see the evolution and all the hard work you and your team have done to bring Elation Health to the market and really helps primary care doctors and many doctors. So appreciate you taking time to talk with us and share. You're super insightful, and I love the perspectives that you offered. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Kyna.
Thanks so much, John.